Hi, this is an instruction on how to set up the Altrix Hypothermia, therapeutic hypothermia. This is a fairly easy setup. First thing you do is you get your machine, plug it in. You're going to have to place a probe, temperature probe. Your primary probe is going to be esophageal, and then your secondary, which would be the primary is attached to the machine back here, right here. And so it is set up to go into the esophagus, and then you always have a secondary to keep as a backup temperature to make sure you're running okay since you're doing therapeutic hypothermia. This will be either in the Foley or a rectal probe. You'll have your pads all set up and ready to go to be inflated. You have to fill these with water before you can place them on the patient. Make sure there are no kinks in your tubing. Everything's open. If there is any kind of a kink, the machine will show an error. If there's an error, only Biomed can fix that. So just confirm that there are no kinks. You'll have 2 legs and you'll have a chest set up. Now the Altrix you can also use if need be. The cooling blanket, it can also be used for that. But we're right now setting up for hypothermia. You have 3 cables, the access for 3 cables. You'll have 2 legs and a chest. Right now I'm only showing you 2 setups, so you would not have your 3rd setup in. Let's say for some reason someone had skin issues on one of their legs. You would only want to put your hypothermia pads on the good lead, not anything with broken down skin or any skin issues or circulatory issues. And also the doc would have to write his orders of where they want this patient therapeutically. So first thing we'll do is we'll go over to the machine. And once it's plugged in, you'll see a green on button. You just press that and the machine will come on. Right here, you'll see that the temperature probe shows temperature probe for room, the first A, and that's what we have it set up with. You have automatic, manual, and monitor. What we want to do when we do therapy, we want to go to the automatic. So I will hit automatic. And right now, it's showing the patient's temperature at 39.5. So we want to cool this patient. Let's say the doctor has ordered for the patient to go down to 36. So your target, this right here, you want to take it to the next level, and you want to check that. You want, when you're cooling someone, you want to cool them as quickly as possible. So what we want to do is I want to lower this to 36, and this machine will cool them, monitor with the patient temperature and your target of 36, and it's set and ready to go. Okay, and you do the usual checking the skin every shift to make sure there's no breakdown. You don't put any medication pads underneath these patients, no transdermal, because the temperature will alter the delivery of that medication. But these are also friendly in MRI or CAT scan. Now, some of the things to remember is when you're filling up, you've got your reservoir right here. That has to be at maximum before you start. You make sure that that is at maximum. You fill it with sterile water. So, and it lifts in and out, and you leave the water in there after you've done filling the patient. So at this point, these pads are filling up. Once they've filled up and they're ready to go, then you place them on the patient. And not until that is done, because it would deliver inequality on the temperature. So you want everything filled and then you place it on the patient. Unfortunately, this is not the type of machine that times the 24 hours. So on the pads, write the date and the time that you're starting the therapy, and then 24 hours later you have to manually go to the rewarming phase, and then all you would do is you would increase to, let's say it would be 37.5 0.6, and that's where the doc would want it, and then the patient would start rewarming, and that's the mode that you want it in. And that is how you set up with the hypothermia, the therapeutic hypothermia, using the Altrix. And if you need any reinforcement, there's always the book that is kept in the machine. In the back, there's a lid here where you have extra supplies. You have other temperature probes. Your cable, your third cable is strapped right here. And that is how you do hypothermia with the Altrix. Thank you very much.